One of the biggest sources of pain to a laboring woman is when the baby is in an occiput posterior position, sometimes abbreviated as OP, or sometimes called sunny side up. What that means is that the baby's occiput, the back of its head, is facing towards the back of the mother's body. Ordinarily, the position of the baby is that the back of the baby's head is forward. When the baby's head is back like this, the woman is going to have more back pain because that hard, bony part of the baby's body is going to be pressing against her sacrum and causing a separation of the sacrum and ilia bones that normally do not separate. Those ligaments that are not used to movement are going to be experiencing pain as a result of the position of the baby. Now, the best thing we can try to do is encourage the baby to turn positions, and there are a variety of ways that we can do this. Okay, now another technique you can use if you're having a lot of back pain during your labor is to do a pelvic tilt. Now, one variation is to lean like you are, rig the bed up to where it's at an angle, lean into it, and then in this position to do your pelvic tilts. And I just want you to push, you know how to do the pelvic tilts, put your back up, good, and then back to neutral, and back up, and to neutral. Great. Now, if you don't want to do it laying in the bed, or if you don't have the bed up, then you can do it on your hands and knees here, as long as that's not giving too much stress to your wrist. If you're having any carpal tunnel or tenderness in your wrist, this might bother you. So another variation you can do is to take your physical therapy ball, the birthing ball, and to lean on that. Now, the thing with the ball is it kind of rolls, so Bob will want to support it from one side, anyone help to support it, and you can do your pelvic tilts while leaning on this. Now, if you're doing this on the floor, sometimes women kind of like to use the ball to kind of sway back and forth, and that kind of feels good to them too. You probably might feel more stable doing that on the floor. Okay. Another helpful move that you can use if you're having back pain in labor is to do some lunging. There's a variety of different ways that you can do lunging. You can hold on the hospital bed and take a nice stance with your feet, and first lean, lunge, move in one direction and then the other direction. Okay, good. That helps. If you stop and think about what that's doing, your pelvic bones are here. When you open up to lunge and then move back and forth, you're making your pelvis opening, and that gives more room for the baby and encourages that head to move. Now, other alternatives, you can actually do the lunging sitting on your birthing ball. You can sit on the ball, which is a very comfortable position for a lot of times in labor, and to rock back and forth, do your lunging from here. Now, another helpful way if you're doing your lunging is to also lean forward as you're lunging. And then you're getting the effect of gravity to help encourage that baby roll over too. So any time that you're having the back labor, you want to go into one of your lunging, your pelvic tilts, something like that to help alleviate the back labor. Some standing positions that you can use in labor that are helpful with back pain are walking and moving around, climbing stairs if they're available. You can also do what's called a slow dance with your husband. So Bob's going to support you, but you're just going to let your arms drop down, and he's going to hold you up, and then you can just kind of sway back and forth. And getting that swaying and movement helps move your pelvis and allowing the baby to move. Now, if you have a doula support person with you, she can be back here giving you back massage while Bob's holding you, or he can have his hands a little bit lower and apply some pressure on your low back at the same time. Now, another position I'm setting you up now for is a position that's going to help elongate her spine, which is very good during labor. This feels wonderful to women during contractions. And it's also a good position to push in the early stages of pushing. You wouldn't want to deliver in this position because it can put too much pressure on the perineum to be in a complete upright position when you deliver. But early pushing or during contractions, what you're going to want to do, Bob, is sit on the hospital bed or the counter, have a chair under each of your feet to support you, and then Tenny, what you're going to do is you're just going to hook your arms around, and you're just going to let your body weight hang. and do this during the contraction. Now, if you have a doula with you, she's going to be down here talking you through the contraction. She might be rubbing your back, anything like that, breathing with you, just giving you some eye-to-eye emotional support. And then when the contraction's over, she's probably going to help come lift you up. Okay? So that's a wonderful position. You'll find a lot of women love that position for labor.